Hello and welcome back. I'm Dr. Todd Cox at Yavapai Foot and Ankle Center in Prescott, Arizona. Today we're going to talk about some diabetic do's and don'ts. Before we get into the do's and don'ts of diabetes, I just want to touch briefly on what diabetes is. Diabetes is a chronic disease in which our body has difficulty handling sugar. When the diabetes is uncontrolled, we'll have an elevated level of sugar in our blood, and this can cause a lot of health problems, things like difficulty with our eyes, our kidneys. It can affect our heart and our skin. What we want to talk about today specifically is how it affects our feet. Diabetes affects our feet because of something called neuropathy or nerve damage which occurs. Also, it can diminish the blood flow to our feet, and that inhibits our body's ability to heal wounds. And so something like even a very small cut can become a very serious problem if not attended to promptly. So, the do's of diabetes. One of the things that we want to make sure that we do is inspect our feet every day. We want to take off our socks and our shoes, and we want to look for anything unusual, cuts, sores, areas of redness. We want to look for any abnormal swelling, things like that. Something else that we want to do is before we put our shoes on, we want to make sure we shake them out and make sure that we don't have any debris, little pebbles or other things in our shoes that could cause a problem. We want to make sure that we're moisturizing our feet regularly. We want to prevent dry, cracked skin that can become infected. We also want to make sure that we're wearing appropriately sized shoes, appropriate socks, socks made of a good material that's not abrasive. We want to make sure that we're checking our blood sugar regularly. We also want to make sure that we're having regular visits with our doctor to make sure that everything is being managed well. Now, there are also several things that we don't want to do. Something that we don't want to do is we don't want to ever walk around barefoot. We want to have some type of shoe on our feet whenever we're walking around. We also want to make sure that we're wearing socks when we have shoes on our feet, and we don't want to let those socks ever get bunched up inside of our shoes because that can cause pressure, which can create a sore. We also want to not ever ignore a problem. If you see a cut, a sore, if there's an area of redness, we want to make sure that it's being looked at by a healthcare professional right away. We want to make sure that we don't ever soak our feet in hot water, and we don't want to expose our feet to the cold. We want to make sure we're keeping our feet protected. When we have diabetes, we're at higher risk for complications that can sometimes lead to very serious infections and even amputations. But if we're vigilant, we take preventative measures, this doesn't have to happen. If we're very careful and we're watching our feet, there's no reason that we have to undergo these very serious limb-threatening issues that sometimes do arise. I hope that you have found this information helpful. Again, thank you for joining us, and please follow us on social media.